Miss Deborah. My name is Ifama Obadike. I am a student nurse practitioner, and I will be doing a respiratory assessment on you today. Do I have your consent to do this video? Because this video is going to be on YouTube under unlisted for my instructor to grade me. Yes. Okay. Thank you very much. So I am going to start my assessment by washing my hands, which I already did before I walk into the room. So I've washed my hands, then I'm going to start. First, it is inspection. So I am going to inspect the anterior part of our chest. Then I am inspecting for symmetry. I'm inspecting for the rise and fall of her heart. I'm inspecting to make sure that the labor, whether she's laboring to breathe, the rhythm. I'm inspecting for the retraction and how she's using the accessory muscles. So after I assess all this, which there is symmetric, it is symmetrical, the rhythm is regular and even. I'm going to the back and I'm going to do the same thing. You turn your back to the camera down there. So that side her back, and I am doing the same thing. I am assessing for symmetry. I'm assessing for rhythm. I'm assessing for the rate. I'm assessing for how much effort she's using to breathe at this point. I'm assessing for any kind of deformity on my patient. So thank you. So I am assessing the APA ratio, which the normal APA ratio is usually 1 to 2, and which my patient is. So at this point that I'm done with assessing this, I go into my next point of assessment, which is I want to assess her nails. So I'm assessing these nails, checking to make sure if there is any clubbing or not. And the clubbing is a sign that oxygen, it's not perfused very well. She's not breathing very well. There is some oxygen deprivation. So I am assessing it. There is no any kind of clubbing because I'm going to assess both the right hand and the left nails. Both of them, they are good. There is no any sign of clubbing at this time. I am going to also be assessing her fingers also, the overall finger of the color and everything for cyanosis. So you assess the finger for cyanosis, and also I'm going to assess the lips for any sign of cyanosis, and especially for the dark skinned people like us. So it's kind of sometimes hard to see this cyanosis. So we may have to look at the patient's mouth and to see more better on the cyanosis of this patient. So now that I'm done with inspection, I am going to go into palpation. So the first thing I'm going to do is the respiratory excursion. So the extent of the symmetrical, I'm palpating it to see if there is any contour, any abnormalities, any tenderness. As I'm palpating it, I'm asking my patient, do you have any abnormalities? And there is none. And then I will go into doing what is called the tectal femmetus. The tectal femmetus, I will ask my patient to say 99. And as she said 99, I want to feel the vibration. So I'm going to do this on the anterior and both the posterior. So let's start on the anterior first. So, but I have talked to my patient. She has refused to take off her clothes on the camera. And so she's going to have her clothes on. But in a clinical setting, where I will have a privacy, my patient will be able to take off her shirt because the tactile femmetus is well better heard with the patient not having their shirts on, their clothes on. So that's why she have her clothes on. Okay, so now can you say 99 for me? 99, 99, 99, 99. So I'm going to also do the anterior while you are facing the camera. So my patient is now facing the camera. I'm going to come down and I'm going to ask my patient to say the same 99, and I'm going to start up here. So go ahead, say 99 for me. 99, 99, 99, 99, Okay. So I heard it, I felt it, but it wasn't that much because my patient it have some clothes on. But without clothes, you'll be able to feel it a lot better. So the next thing that I will be doing is that I will be doing my percussion. So on my patient, and this is going to be done side to side, using my middle finger and the other finger on it. Then percussing my patient on all long sounds in all the long fields. So I'm going to start at this point. So when you percuss, what I'm listening for is the tympanic sound, the resonance. So the resonance. So when I hear that, when I hit when I hit an organ, I will hear that dull sound. So, and the same I am going to do on the back. It's usually heard very well, better on the back because of the breast tissue that we have in the front as women. But in men or people who are a little bit overweight. So I'm going to start here and do this for this patient on the anterior side. So it's just so you do it side to side because you are comparing the sound you hear from this side to the one you hear to the other from the other side. Okay. So now I've had I've done the percussion. So I'm going to do what is called the diaphragmic excursion. In diaphragmic excursion, I will ask the patient to inhale and hold it. Then I will percuss. Can you inhale and hold it for me, please? So I got to this point where I hear some dullness. I will mark it. Let me grab a pen. And then I will mark it right here. This is where I hear the dullness. Then I will ask the patient to also exhale and hold it. Can you exhale and hold it for me? So can you let me go take a deep breath? Mhm. Let it out. So now that she exhale and hold it, I have this point right here, which if I had a tape, I will measure it um, with the patient. So I will do the same thing on this side. I will ask her to um, inhale and hold it. So can you inhale and hold it for me, please? So here, can you let go? Breathe normal. And then I want you to exhale and hold it. So now I have a line here. So this and this supposed to be equal. So if I have a tape and measure it, it's supposed to have the same centimeter and on it. So if there is any variation, then that should be a cause of concern or something that we have to worry about. But for this patient, the distance is equal, even though I don't have a tape to measure with, but when I looked at it, it looks equal. But usually in a normal clinical setting, I should have a measurement. that I will use to measure it for the person, for the patient. So the next test, if you don't mind turning back again to the camera. So that concludes my diaphragmic excursion. So the next one is that I'm going to auscultate my patient. I am looking for that long sounds, which is the vesicular, the the bronchial, or any adventurous sounds like the crackle, the wheezing, bronchial. So that am I hear from my patient. So now I am going to auscultating all lung field, the anterior, the posterior. I'm going to auscultate the lateral sides of my left and my right side. So usually I like to start up here. And you take a deep breath. Listen, deep breath. Okay. So it's always good to listen side to side, because then you are comparing with the two sounds that you hear. And this patient, the lungs are clear to auscultation on the anterior side. So now I am going to go to the posterior and listen. Can you turn to the camera, please? Okay. So her lungs are clear to auscultation on the posterior side. So I listen on all the lung area, and her lungs are clear to auscultation. And for somebody who is starting new, it is usually better, or if you hear some other sound other than clear sound, it's okay to take off the clothes and listen a little more better, because you may hear a lot better if you're starting new to listen to lungs. But with a light cloth like what she have, I was able to hear her lungs, which is clear to auscultation. So I am going to do the specialty test. In the specialty test, I'm going to do one of it that is, I'm going to start with the egophony. In egophony, I'm going to tell her to say E, E, anytime she feels my stethoscope. Then I'm supposed to hear a normal E, what she's saying, if she doesn't have any lung issue like her. But if she do have any lung issue, what I will be hearing is A. So I will do that, ask her to say E. This is egophony. Okay. When you feel my stethoscope, say E, okay? E, 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 E. Okay, can you come back for me? E, E, E. Okay. Okay, so I had E, because she does not have any any problem. So she is normal. So the next one that I'm going to do is I am going to ask her to say 99. So when I listen with my stethoscope, I should be hearing some muffled sound, and that is normal. When I hear that 99 that she's saying, then it's not normal. Um, what's that? So I'm going to ask you. Let's use the posterior back, because that will be a lot. So when you feel my stethoscope, say 99, okay? 99, 99, 99, 99, 99, 99. Okay. So my patient is normal. I had 99. So that is what I am supposed to hear. I am not supposed to hear. I'm not supposed to. I had that muffled sound. I didn't hear 99 because she is normal, and that is considered normal. Okay. So this brings me to the end of my respiratory assessment today. And thank you for letting me use you today. You're welcome.